You are now tuned in to Mind, Body, and Soul with Annette, where your hosts, Annette Harris, analyze intriguing life questions and concerns, such as, do Christians suffer from mental illness? Have you wondered why they act abnormal? Or you may ask, what is really going on in their minds? Do you need a net? Well, keep listening for a biblical understanding of the psychology of the mind.
Hey guys, welcome to another wonderful session of Mind, Body, and Soul with Annette. And I am your host, Annette Harris. Thank you so much for joining us on today, for watching and or listening. Now, you know what I have to do before I get started. Lord, we thank you for all things. We thank you for this day. We are asking that you will get the glory out of this session. Be glorified, be magnified, and we pray that others will walk away with what you want them to hear. In Jesus' name we pray. And our opening scripture I normally like to quote is the first part of Hosea 4:6, and it states, "My people are destroyed for lack of knowledge. Because thou hast rejected knowledge, I will also reject thee." And again, I'm excited to be here on this afternoon. I always tell you, if you see my face around 12 noon on a Wednesday, that means it is time for you to get caught in a net, mind, body, and soul with Annette. And I am glad that you are here with us on this afternoon. Now, before I get started, I do want to encourage you here on my live feed, Facebook Live, or my page, Annette Get Caught in a Net. You will see the live feed. And then also, if you go over to my YouTube channel right now, you will hear the live portion of this session. At the end of the session on today, we will upload the video to match that audio. And so you can go and listen to it at your leisure. But again, let someone know that we are on by clicking that share button. Go ahead, click the share button. I always tell you, it costs you nothing. Just go ahead and click it. And then that will alert others that we are on. We had an event going around, event alert, should I say, for today's session, and we are definitely here. We're normally here 12 to 2 p.m. Central Standard Time every Wednesday, and I am glad to be here yet again. I do see you guys coming on in, and I do appreciate you, because I am going to actually start off by introducing my guest on today. But I do recognize those of you that have jumped on already. J.R. Jordan, thank you for watching. Appreciate you. Karen Peterson, Sandra Richardson. I see there are other names here. Once they come up, then I would definitely make sure that we recognize you. I am glad, actually. I have been connected with a beautiful young woman that you actually see in my presence right now. Down to earth, real down to earth. And I must say a shout out to JR for making this connection for me. He's my big brother. So he reached out to me and talked to me about this young lady. And I said, okay, I trust you. All right. And so we made the connection. And here in my presence is Dr. Knitasha Washington. And, you know, I'm appreciative that I'm connecting with another sister. I really am. And I am grateful to you and what you're doing. But how are you doing on today?
I am awesome. And it is awesome to be in the presence of another female with similar energy. So it is a blessing to have met you through our mutual brother. So thank you for having me today, Annette.
Oh, you're so welcome. I'm so glad that you accepted and you're here on today. So, you know, we can get started, because this is when he reached out to me and I said, oh my God, that is actually a good topic to talk about. Stroke awareness during COVID. You know, we know that for the past 7, almost 8 months, we have just been in this pandemic. Well, it was told to us in the past 7 to 8 months. We'll just put it that way. But we've been dealing with this COVID, we've been dealing with this coronavirus, and it has taken a toll on us, whether it is spiritually, mentally, physically, in every aspect of our lives. It is actually kind of taken over a little bit. And some things we think about and some things we don't, like how this is affecting individuals mentally, how it's affecting them, their health, because, okay, you immediately think, okay, I don't want to get corona, you know, you don't want to spread it or anything, and you're praying for those who have it. But how many of us thought about its relation to stroke, to having a stroke? I'm going to be honest, I never really thought about it. I haven't. And then sometimes you don't necessarily think about things like that until it either, God forbid, it's happened to you or somebody else in your family. So that's why we talk about awareness on today, because we want to bring awareness to this situation, because it's definitely not anything that we should look over. So we're going to kind of actually, let me do a little bit. I'm going to ask my guest to introduce herself. I have your beautiful bio here, and it is filled. Trust me, it is filled. And of all her accomplishments. But if you could do me the favor and introduce yourself, Dr. Washington, to my guests, to my viewers on today. If anyone was to ask, who is Dr. Washington, what would you say?
Yes. So again, thank you, Annette. So I have a long-standing history in this space called healthcare. I've actually worked in the space as a healthcare professional for over 20 years now. I like to say that I landed in the space by default, and it's because I was a teenage mom back in the early 90s looking for a job where I didn't have to work multiple jobs and could go to school and take care of my baby at the same time. And healthcare was that booming space, right? And so I happen to be blessed to coming to the field early in my years. I have focused in what we call quality improvement, right? So my space in healthcare has been all about understanding systems, and in particular, our healthcare delivery systems, how they operate. And I have partnered with hundreds of hospitals across the country. I've worked with government agencies. I have worked with both public and private organizations and or agencies over the years, basically culminating in an experience of what we call healthcare transformation. So my work is really about transforming the health system into a better system for all people. So that's kind of the nuts and bolts of it. In terms of my what I do professionally, so I am also a researcher. So I have a doctorate in health administration from Central Michigan University. I have a business background. And In 2009, what really was the catalyst to really starting ATW Health Solutions was the death of my father, which was due to a preventable um, medical error. And it was his death that really opened my eyes to the to the real issues in healthcare. Like, so think of it from this perspective. Here I am, working as a professional over the years, working with major, institutions across the country, academic, tertiary, you name it. I had been in those systems, working to improve the way they deliver care. And then I have this very personal experience that really, like I said, just opened my eyes to what it looked like, what healthcare delivery could look like when it goes wrong, right? And before that, my understanding of it was either textbook or, reading reports. But when it's personal and it hits home in the way in which it did, it really jerked my heart to make a full commitment that this is my work, this is the space that I'm going to live in forever and ever and ever, amen. And so I've made that commitment. So quality improvement is what I do. And let me say this one last thing as it relates to quality improvement, because there are a lot of folks that focus on quality improvement. That's nothing new. Performance improvement is nothing new. A lot of folks professionally trained in the space know how to do this forward and backwards. But what I do different is my recognition nationally has really come from the precedence of my incorporation of real people, patients, and their stories into the way in which healthcare delivery should look. And the reason why I do that is because I recognize from my father's story, as well as the evidence of others that live in the communities that I've lived in, and my aunts, uncles, and friends, that oftentimes folk that come from, backgrounds that are of brown and Black descent, that our experiences in the healthcare system are different. And so because our experiences are different, as is our outcome. And so, if we're really going to improve not only the healthcare system, we also have to make certain that we're improving it for the purpose of improving healthcare outcomes for all people. And so, that's really what my focus is. So I don't just do quality improvement. Yet I love it, but I do it for the purpose of improving outcomes for all people, in particular, populations that look like me.
Yeah. Oh, I love that. I mean, that was a perfect description of yourself. And it's amazing to me how things happen, but that goes to show you that you had a passion for it. Um, for the system, making sure the systems work for everyone. And then you just had that added unfortunate, with your dad passing, and then seeing firsthand, if you will, that, like you said, that personal experience you had. So that kind of added on to what you were doing. And yeah, somebody has to do that part, that this, what you're doing. And again, that's something that we don't readily think about. We don't think about something like that. We're just like, okay, if somebody got to go to the hospital, somebody got to go to the doctor, they got to go. You don't think about all the, the underlying or the background of what you do. But somebody has to do that so that these systems, like you said, can work. So I do thank you for what you're doing, and for everyone that it will definitely affect. Let me see here. I'm looking here on Facebook Live and wanting to let you all know we're talking again today about stroke awareness during COVID-19. There's so many things, as we started off talking about at the beginning of the session, that we face we have faced and are maybe continuing to face during this time. But we're focusing on stroke awareness on today, because that is something that has not necessarily been discussed. I really haven't heard it being discussed on a major, especially since this coronavirus started. So Dr. Washington is here with us today, and we're going to chat with her about this. I have a few questions that I'm going to talk with her about. And again, thank you for mentioning about your dad. I mean, I know that that's personal, but thank you so much for mentioning that about him, because again, people need to know where your passion lies. Cheryl Hartshorn Stevens is on. Thank you for watching, my good friend. Crystal Garrison Cooper, Janetta Franklin, Byron Hill. And when you guys come in, please make sure you click the share button. Because I'm telling you, like my late pastor used to always say, you may not need this message now. You may have to put it on the shelf, but if it's on the shelf, you can pull it back down when you need it. So we want to make sure that everyone is informed on today. And if you have questions for Dr. Washington, you can throw them into the chat section on today. And then, we can have her either answer them here, or, she can go back on the live feed and respond to your questions, but we will definitely make sure that she sees them. So let's hop on over to our first question that we had here. Has this topic of stroke awareness during COVID-19 been a major concern? We can say that it has, but I want to hear from you, what your thoughts on it. Has it been like a major concern that maybe some of us were oblivious to?
Yeah, so I think it is definitely a growing concern. And the reason why I say a growing concern is because there's so much that we have yet to really understand about COVID-19, right? We are in the midst of, a pandemic that on every day, literally, we're learning something new. And I think the testimony to that is, when you turn on the television from day to day and you see the stories or you hear the stories and the cases, we're just in a continuous learning environment in terms of novel COVID-19. So that I think that's the first piece. The second piece is I think back to when we began this journey with COVID and this journey in our attempts to really understand what was going on. Um, One of the first things that we began to see were, like I said, going back to the stories, and quite honestly, before the statistics solidified themselves, I could see where things were going in terms of the disparities in our outcomes, right? And that's because when you looked at the stories, they were often individuals of African American descent. They were Black people, right? I mean, just be honest with us. You know, at the end of the day, when you saw the stories on the news about who was dying and so on and so forth, you know, the majority of the cases, you know, we were seeing were Black people, at least the ones that I saw on the news. And I don't think that, you know, I'm isolated from anyone. So it was kind of beginning to evolve or tell on itself, if you will. And then, of course, and I'm certain that, you know, would be the case with you, Annette, the stories began to become personal, you know, where now I'm hearing about very close friends who lost a grandmother and who lost a significant other. And then it transitions to now I'm losing an uncle and I lost another loved one, you know, a grandmother. So at the end of the day, it started to really become more personal, where you were hearing about more cases, and not only were you hearing about more cases, you were hearing about bad outcomes related to those cases. And in many instances like mine, they were, you know, individuals that I was connected to, or that were, you know, a part of my life. And so the disparity statistics began to emerge, and we saw where, you know, whether it was the city of Chicago, the state of Illinois, we saw the state of Michigan, and we saw others begin to report that COVID data stratified by race and ethnicity. So we began to see that there was definitely disproportionate outcomes in terms of the number of cases being reported and the number of deaths being reported, that we were seeing higher rates of persons from, like I said, you know, the Black community as well as the Latino community, that we were seeing this COVID-19 a greater precedence there. And so as the story begins to uncover and begins to evolve, of course, many researchers like myself began to, you know, just, you know, dig around to better understand what is this connection, you know, between the African American community or the Latino community and COVID-19, right? Is it truly because of the fact that we tend to be sicker, right? That we, you know, tend to, you know, have higher rates of obesity, or have higher rates of heart disease, whatever those things might be. So the comorbidities that exist, was it truly because of that? And then what we discovered was that there actually was a relationship between COVID and stroke. And what that relationship is blood clotting. Okay. So at the end of the day, COVID-19 actually does cause small blood clots. And that is the similarity that it has to stroke, which means that the probability of one having a stroke does increase, or it does increase as a result of having COVID. So having worked on stroke research before, I then partnered with two of my colleagues who are both neurologists. So I'm a researcher, they're neurologists. Dr. Shyam Prabhakaran, who is over at University of Chicago, he actually is the division chair. So he's over the division of neurology at University of Chicago. He's over that program. And then Dr. Neelam Agarwal, who is over at Rush. And so she also is a head neurologist within their program. The three of us had partnered back in 2014 on a stroke disparities project that we call CERIS. Okay, and the acronym CERIS stands for Community Engagement for Early Recognition and Immediate Action in Stroke Initiative. So Basically, what this was a program, a research study that we had put together to really help educate individuals in the Black and Latino community specifically on the signs and symptoms of stroke, and in hopes that we would actually improve outcomes. And when I say improve outcomes, just a little bit more history before we go to the next question. So stroke has vacillated between positions 4 and 5 in terms of the leading causes of death in the United States. So stroke is right now, it holds its place as the number 5 condition or leading cause of death for individuals in the United States. That's across all races and all ethnicities. There are about 800,000 strokes that occur every year. And so now we add COVID to that. Okay, so when we look at the COVID statistics, COVID actually has moved into position number 3. So COVID is now the 3rd leading cause of death in the United States, and stroke has remained number 5. Okay, so again, going back to that relationship that we know that stroke and COVID have as it relates to blood clotting, and then also understanding some of the access issues that we have had, meaning the Black and the Latino community, in terms of getting to care timely, was one of the reasons why the 3 of us got back together and said, you know what, we have to do something here, because stroke isn't going away, right? And we know that COVID doesn't look like it's going away anytime soon. And so we needed to pull together a program to really help individuals, sorry about that, understand not only the relationship, but also understand what can we do, what's in our control, what can we do to help produce better outcomes for our community. And so that is really the impetus behind the research that we're doing.
Okay. Well, you know, that's good. I mean, very wonderful answer. But I'm glad you went into talking about with COVID, how in the beginning with COVID, you know, I would hear people would talk around, oh, COVID, we don't have to worry about it. Black folks don't get it, da da da. And then you started hearing all the, you know, the deaths surrounding it, those who were contracting it, and how the, you know, the scale was tipped. You know, more so Blacks, you know, and then, you know, Latinos as well. But yeah, it's something, and I don't know if that was because maybe people were scared, you know what I mean? And they just didn't want to believe that they would contract it, you know, themselves. Because I literally heard somebody say, oh, I'm not worried about COVID, you know, because it's not going to kill anybody Black. I literally heard somebody saying that. I'm like, wait a minute. But this was before, you know, all the numbers and stuff started coming out. I'm like, okay, are you guys still saying that? You know what I mean? You can't just, you know, take it for granted. But then also, go ahead.
So that's the reason why I do the work that I do, right? So, you know, to that exact point that you stated, right, is that, you know, I would hear things from people in my community, relatives, what have you. Even my own father didn't want to go to the doctor. And I clearly understood the history behind it, but you're absolutely correct. That reality is the reason why we have to have people that are committed, right, to getting us to understand better so that we do better, so that we produce better outcomes. And that's not just a responsibility of us as a people, that's also a responsibility of the healthcare system, right? And so, you know, my work toggles between the two and attempts to fully integrate both so that the values and belief of people are respected and understood as we go through this journey called life, right? And that we're creating healthier outcomes. So you're absolutely correct. I heard some of the same things And, I remember being in the store one day and a gentleman, a young black guy, he probably couldn't have been any older than maybe about 20, 21. And he walks in, he doesn't have a mask on. And I remember getting into this whole dialogue with him about wearing a mask, because at that particular time, there was still a lot of conflicting information, being spread from through the news medias, right? About the need to wear a facial covering. So, at the end of the day, we need to have better information. We need to understand what some of the myths that are out there. And I'll tell you, even as I go into some of the conversation around stroke, our research really was built on the foundation of a lot of myths and misunderstanding in the community and miseducation in the community, right? If you'll allow me to kind of go there a little bit. So I told you, stroke is, toggle between five and number four in the country. It has steadily demonstrated itself in terms of disproportionate outcomes for the Black and Latino community, meaning that when you look within our subpopulations, that we have higher rates of stroke, and we have higher rates of death and disability as a result of stroke in our communities, okay? And so when we began to understand what the healthcare delivery system really looked like and what it was able to deliver in terms of care, because let's just be real honest. Many of us understand that our communities don't always get the best of care, right? And so one of the challenges is just to understand, well, do we even have enough hospitals that can manage stroke, so on and so forth? And what we learned and what's demonstrated in the evidence is that we have stroke certified centers in Chicago. There are actually 23 that are in Chicago proper. And then if you go on the Illinois Department of Public Health, their website, they actually list all stroke centers throughout the entire state of Illinois, which expands to a much greater number. My point in saying this is that there is adequate coverage to actually care for us. Mm-hmm. But the fact of the matter is that we, meaning Blacks and Latinos, were not getting to care timely. And what do I mean by that? So stroke is a time-sensitive disease, okay? The window is about 3.5 to 4 hours from the onset of stroke that we actually have that critical window where we can care for it in such a way that we literally are able to reverse the signs and symptoms of stroke, right? Okay. Meaning that there's medication that if you get a person to the hospital that's having stroke, and that's done within that window, there is a particular medication, it's called TPA, and TPA can be administered only within that window. So what that means is for all of the folks that I would go to churches and talk to people, and they say, I woke up in the morning and my face was drooping. I woke up and I couldn't lift my arm, but I went to work anyway, right? Because it doesn't physically hurt you. It's awkward, but it doesn't physically hurt you. Or, I was talking and I couldn't understand my own words, right? But that person proceeded to continue to go cook dinner for their husband or whatever. And it's that delay in time that has been a critical barrier for us as a people for accessing care. So what am I saying? I'm saying that if in those instances, we had some behavioral things that we needed to manage and or understand, I should say, so that we can get past those barriers and get to care more timely. And that's really what this research was about. It was about getting people information so that they can make decisions quicker, so that they can get to access more timely, so that they can get better outcomes. And that's literally the work of the CIRRUS project. So it's important to understand that stroke is time sensitive, and you need to understand the signs and symptoms of stroke. And once you understand the signs and symptoms of stroke and we educate our community on that, once we're able to ascertain, okay, these are the signs and symptoms, now we got to get to care, because we know we only got 3 hours, we only got 4 hours. And here's the thing, there were a lot of myths around, well, if I go to that hospital, you know, they don't have a real good reputation, or if I go to that hospital, but guess what? When you call 911 here in the state of Illinois, 911 is required to dispatch you to the closest certified stroke center. And a certified stroke center, those organizations are held to a different standard as it relates to the way in which they deliver care for stroke. What does that mean? That means that they are literally counting the time that it took the ambulance to actually get you to the hospital. They're counting the time that from the ambulance arrived to when they got you in the bay, how long it took. They're counting how long it took for the attending physician to actually order a CT scan for you. So there are there's a number of qualifications that certified stroke centers have to adhere to in order to have the prestige of being called a certified stroke center. And what we found is that in African American communities, we were not accessing certified stroke centers timely. Although we had them, we were not going. And so what we had to understand, and what, as a researcher, what I had to really delve into, with the partnership of folks like JR and others, is connecting with people in the community to understand why. Why weren't we getting to the hospital timely? What was going on? The reasons why we weren't calling 911, or the reasons why we weren't activating the system. And here's some of the stuff that we heard. I was waiting on my friend. I didn't want to go to the hospital by myself. I was waiting on my neighbor to come home from work so that they could go to the hospital with me. Or, you know what? I was not about to call 911 because I know that I was going to get hit with that ambulance charge. I'm certain you know exactly what I'm talking about, because I hate seeing it myself. But that's a reality. So that financial, piece of it, that I just didn't want to deal with another bill. So I didn't call 911. I got in the car and I drove myself to the hospital down the street, or another hospital, because I didn't like that hospital. But guess what? That hospital you passed up was a certified stroke center. So these are all things that our community just did not have knowledge of. Some of the other things that I heard, and these are real stories, the fear of being wrong. And that's one that we often as a people deal with. Like, I don't want to go because it might not be that, or I just got a headache, and let me lay down, and let me lay down, and it might go away, those types of things. The other thing that we heard, and this was probably more with the Latino population, but I think we can respect it, even more over now, given all of the structural racism issues that we see in our criminal justice system. But, a lot of folks had fear of police. Like, they didn't want to call 911 because their son was at home on house arrest. And they were afraid if they called 911 that the police would be more concerned about what was going on with the son than they would be concerned about getting, mother to the hospital in time. And so these were real issues that we heard in talking to folks in the community. And we needed to develop an educational system that not only helped people understand or rid themselves of some of the myths, right? But also gave them the right education so that they could properly respond. And again, that's really what the research was about. And let me say this, as when we did the research from 2014 to 2019, at the end of that research, we did see improvements. So the rates did go up in terms of younger people. The rates went up in terms of men, and the rates went up in terms of Black folks getting to the hospital in time, or more timely, as a result of that work. There were over 247 stroke promoters that we trained on these issues, right? That we built a community of folks that had networks. So we were in churches, we were in nightclubs, we did, wherever we could spread the message, we did that. And as a result of that work, we were actually able to improve outcomes, seeing that, folks were getting to care more timely. And that's what we want to express in this COVID environment, because it hasn't changed. But the fears have changed, because now, in addition to all the other stuff that I've talked about, folks are afraid of, I don't want to catch the Rona. I don't want to, I can't go out, the house, or I don't want to go to the hospital because I'm more likely to be exposed to someone who has COVID-19. And so the fears have increased. But the conditions are still the same. And in all honesty, given both COVID-19 and stroke, and the way in which both of them attack, our community, is of grave concern that we have a better understanding of both, and that we operate in better knowledge, so that we can save ourselves, basically.
Oh my goodness, Dr. Washington, you have really been talking some good stuff. This is good information that you're giving us. And it's amazing, because when you talked about the different issues that people have by not going to get themselves checked out. We can in a minute, oh, it's probably just this, is that, I can finish doing this. And all the while that person is literally having a stroke, and they don't really realize it. But I'm grateful to you for this research and this project, and those you've partnered with, because it is definitely it's going to help somebody for sure. We know that. Some were commenting on here. They were saying there were some things that you were talking about that they just didn't know. So it's good to get this information out. First, it's good to do this research that you're doing in this project. Again, that attests to your care and your concern for people. So thank you again for that, because we want to help save some lives, and then, do away with all the myths and everything, because you named it, quite a few of them. You don't want to go to that particular hospital, or, and then now, of course, and I'm glad you ended it up with talking about the fear of corona, because I can tell you there are some probably like maybe have some other, whether it's stroke or not, they have other conditions. They don't want to go to no hospital now.
Hello.
They don't want to go around anybody like that.
But here's the thing, in that hospitals, have been dealing with this, meaning the safety precautions. That's what we do, or that's what they do professionally, right? That's the business of healthcare. You think about anyone who's had a surgery, right? When was the last time that you were afraid to have a surgery at a particular hospital because you thought that the place, was full of germs or what have you? I mean, the reality of it is that's the guidelines that the healthcare system operates under in normal circumstances, right? Like, we learn how to guard, protect, clean. Those are, those normal safety precautions that are in place. So, quite honestly, accessing the health system is probably one of your safer bets than not, because the reality of it is that they are still operating under those protocols, and have how can I say, expanded those protocols because of COVID, right? So, the number of times that we do terminal cleans in a hospital, those have been expanded. The way in which we do terminal cleans in hospitals, those have been expanded, so on and so forth. So when we think about that exposure in the health system, the reality of it is that it is safer to get you to the hospital to access care than it is not.
Wow. Good points. Guys, let's make sure we take this in. I'm going to recognize you that are here on Facebook Live. I do appreciate you hopping in. So many have joined since we have started. We're talking today with Dr. Knitasha Washington, ATW Solutions, and she is discussing today about stroke awareness during COVID-19. I see you, Michelle Casey. Thank you so much, my dear, for watching. We appreciate you. TJ Dow is on. We thank you. And Beatrice, she's on. When I first put this post up, before I mentioned the other names, Dr. Washington, she hopped in and she commented, she said, thank you so much. And I said, thank you for what? She said, for talking about this subject. Her mother, who is up in age now, I think she's in her 90s, correct me if I'm wrong, Beatrice, but she had a stroke. Her mother had a stroke. And so now she's saying that they're watching, they're keeping their eye on her and everything, but she's doing good. But she was just appreciative of this particular subject coming to light here. Kayla, I see you on. Thank you. Auntie San, I don't know if I mentioned you, but thank you for watching. We appreciate you. Nicola Jones, Beverly Ann. Let's see who else here that I did not call. Elder McGee, I do appreciate you. Elder Pastor Philip Riddle, thank you for watching, my brother. I appreciate you. And thank you, those of you that are tagging others in here. I thank you for that as well. Apostle Hunt, my good friend, that's my co-host for Thursday night show. Thank you for watching. And Buddy Gill is on. He says, good afternoon. There's a statement here from Elder Kevin McGee. He says, in 2004, I went to the ER for severe headaches. When they did the CT scan, they ruled it a mild stroke. But when they did the MRI, they saw nothing. But after that, I started watching how I treated my body and did my best to not allow stress to overwhelm me. And I learned the importance of rest.
Yes.
Thank you for sharing that. Did you want to comment on that?
One of the other things that, so thank you, Elder McGee, because stress, and we know the history of this, within our community, it is definitely something that we need to manage. And when I think about, again, one of the reasons why we really needed to do this work was because the stresses have gotten all the more, right? From when you turn on the television to how we're managing, what goes on in our home environments, because, folks are, everything's changed. So we're having to, homeschool, children are being schooled in the home setting while parents are trying to work. And it's just, it really does call for another level of stress. And so I really appreciate that comment because with this stroke promotion work, one of the other things that one of the other focuses that we have is promoting healthy lifestyle. So activity, getting out and just moving. And I know that, when we were in shelter in place and we weren't doing a lot of commuting, but just getting outside and walking around the block or walking in your backyard a little bit just to get some fresh air. Those small steps are so critically important to keep us physically and mentally and spiritually in the right space. The other thing, as it relates to health and wellness, is building our immune systems up.
Mm-hmm.
We haven't been as focused on building our immune systems up. We were, quite often eating a lot of fast foods, and I'm still, praying for deliverance from McDonald's French fries. But it's real, right? These are real issues that we deal with, and so having to work on and being focused on eating healthier. One of the things that we were talking about on one of our stroke calls was taking foods out of our diet that can cause mucus buildup. So things like milk, right? Taking more of the milk out of our diets so that we're not putting things in our system, excuse me, that will promote mucus buildup. And
Right.
so, and eating more vegetables. So all of those things are critically important from a preventative standpoint. So you're absolutely correct, Elder McGee. Not only the activity, managing our stress levels, but also the eating healthy. And what we also like to promote is finding that right spiritual space. So we were talking about before the call, my meditation time, because
Yeah.
that is we have to promote this wholeness and healing, right? And so if we're going to we're just a part of this society, and society, it is what it is today. But how can we better govern ourselves as a people? What are the things that we have control over? And that's one of the things that I'm really proud of with this particular body of work, because it puts us in control, right?
Yeah.
It puts us in control, in greater control of what our outcomes and our destinies are, by giving us good information, and giving us good information that we can act on. So yeah, I appreciate that.
Yes, yes. Thank you for those comments. Um, Dr. Joyce Graham, thank you. Got mom for watching. She made a comment here, and she had a stroke back in March. And she says she's been waiting for this show. Thank you. I appreciate that, Dr. Joyce, because she went through an awful lot. And so I'm sure she's appreciative of the information that you're giving as well on today. Dr. Joyce, if you want to make comments or ask questions, we're more than, we're welcoming you to do so. And any of you that have comments or questions on today, whatever Dr. Washington has given us, if you want her to clarify a little bit more, if you want to give an example of some things that you've dealt with yourself personally, go ahead and throw them into the comment section. We're talking today again about stroke awareness during COVID-19. So a few more comments on here. Oh, Dr. Joyce says she's currently in the rehab now. I didn't know. Okay. All right. Okay. Thank you. JR says here, so I guess I need to make more veggies with my oxtails and less gravy, huh?
Yes, he does. And he probably needs to put more oxtails in that, since he got to share with both of his sisters. Absolutely. Yes, he does. We like a lot of string beans in that, JR. Thank you, sir.
Did you hear that, JR? Did you hear it?
But so to the point that I'm making, less processed food. So, really trying. I was talking to my sister about this yesterday. Really making a conscious effort to get away from processed foods. So, as much of a burden COVID has been, on lifestyles, honestly, it's catapulting us into a space that, in a more accelerated way, in a space that we've needed to be in for some time. Cooking more at home. So I was not a really big cooker, but I can honestly say, like many of us, I'm cooking more at home, and it's because of the environment. But that's really the behavior change that I needed to make to sustain my own life, right? And so getting away from processed foods, like I said, exercise, the whole spiritual component of it is the glue, that keeps it all together. But I want to share with you really quickly. The acronyms FAST, and FAST is what we teach, which actually catches about 80% of strokes. So if you learn this, sign and symptom, you learn these indicators, about 80% of strokes are actually caught timely because of the understanding of FAST. So FAST is, the F stands for facial drooping. So if you've ever seen someone where the one side of the face is beginning to droop, etc. For those of you who've seen individuals with like Bell's palsy, it has a look like that. The A is for arm, so weakness in your arm, meaning so you're not able to necessarily lift your arm the way that you would in regular circumstances. So weakness in the arm. The T is actually for time, and so time is that time sensitive, and also tracking of time. So if you see someone, or if you have a loved one where the face, now again, it doesn't hurt. It looks really awkward, but it's not like painful, like somebody just dropped a ball of bricks on your foot and you go ouch, right? It's not that type of symptom. And so what's important is that we assess the time that we first saw this appear, because it's that time that the clock begins to tick in terms of the timeliness of being able to access the TPA, the drug TPA, or to getting to care. Remember, I told you 3.5 to 4 hours. So you want to track time. So one of the things that we share with folks is to, if it's someone you know, or if it could even be yourself, because sometimes it may shift up and or change. Take a picture at that time that you see it, right? So we're talking to someone whose father just had a stroke over the weekend. And he had the facial drooping, but by the time they got to the ER, it wasn't as significant as it was at the time that he was there at the house. And so, but the person had a picture of dad's face on her camera to help the physicians assess where they were. And so just understand that, you know, that time sensitivity, you need to track that. The S is for speech difficulty. So folks oftentimes will say, you know, if they're talking, they can't understand themselves, or speech is slurred. Sometimes people, I've even heard of cases where individuals actually thought, you know, the person was drunk, as opposed to having a stroke. And so understanding fast, F, facial, that's the facial drooping. A is the arm weakness. S is the speech difficulty, or, you know, problem speaking. And then T is time. And then when we talk about time, also remember to call 911. Why call 911? Because it activates the system. There's a system in place, because stroke is time sensitive. You call 911, ambulance will arrive, ambulance takes you to a certified stroke center. The protocols are different. You know, have you ever been into the emergency room, Annette, and you're sitting in the waiting room wondering, when are they going to call my name, because I am in real pain right here, right now? Or when are they going to call my name? I know there are other people that are sick, but I'm really not feeling good right now. And I've been in this, ER for at least an hour, and I haven't seen the physician yet. I think most of us have had experiences like that. Well, stroke, we ain't got time for all of that. So you want to activate the system, and folks need to know, use the word stroke. I believe I'm having a stroke. I have stroke-like symptoms. That requires the system to now become activated, and the protocols go into play. As opposed to you sitting in the lobby and I don't really know what's going on. I never use the word stroke. Now I've been sitting in the lobby for an hour. They just not called me. They put me in a bag. By the time I talk to somebody, I'm just now getting out all of the things that have occurred, and now 2.5, almost 3 hours have passed. No, that's not what we want to see. But that's what we have seen as a reality with our people, because I'm taking matters in my own hands. I stayed at home for 2 hours because I didn't think it was. I didn't want to be wrong, or I had needs to wait on a neighbor. Whatever those things were, we have to rid ourselves of all of those barriers so that we can get to care timely. That's what this is about. And when you're able to get to care timely, the benefits of having a good outcome, meaning not having a disabled outcome, because I remember my grandmother, after having a stroke, she was bedridden for the rest of her life. She could not talk any longer, and she could not walk or stand up again. And so she was bedridden for a number of years, at least 5 years, until her death. And so those are not the outcomes that we want. We want outcomes where we're able to get folks to care quick enough so they're able to get the medication, hopefully reverse the symptoms of stroke so that they can continue on with their normal lives.
Wow. Okay. Ooh, this is good stuff. Good stuff. Listen, I was going to ask you, someone had sent me a note to ask you to turn up your mic, but I think it turned up automatically by itself. They said they don't want to miss anything that you have. But thank you. While you were talking about the acronym FAST, I was trying to type it in the feed so that everybody could see it. And some of you may have seen that acronym before and know that how it relates to strokes. But again, this is information on today that we're trying to, again, get across to you, whether you need it for yourself or you need to pass it on to someone else. So those of you who are just not joining us, thank you. You may have to go ahead and rewind once we're done on today to hear the entire session. Great information that I'm telling you, you do not want to miss. Let's see. Oh, goodness. Ernest Brooks, I don't think I recognized you, but thank you for watching. Buddy Gill says, this is why this show right here, Get Caught in the Net, is a great show.
Yes.
That was nice. He said, this topic applies to us all. He says his mother had a stroke a few years ago and it has their changed life for her as we all knew it. He himself received warning signs from his doctor to change his habits as well as his diet because he was knocking at stroke's door. Thank you, ladies, for availing yourselves to educate us all. Well, Dr. Washington is educating us. We're just providing the platform, but I'm grateful too because again, you never know sometimes, what someone is dealing with, until sometimes I may put out a promo about something. Oh, yeah, that, and then it strikes up a nerve or touches on something personally for some individuals. Now, what I want to do, Dr. Washington, I know we were working with just a short amount of time with you on today because she's a very busy woman. She's busy, but what I want to do is to see if we can have you address Dr. Graham's question, the one that says she's currently in rehab. She asked if you could talk about the road to recovery from strokes. Now, I had questions lined up for Dr. Washington on today, but I knew this would happen. Sometimes you kind of get off into one question and it activates other questions or other things you might want to address from that, which is fine. As long as we are addressing those situations that those who are here on the live are in need of. So is that something you can do for us? She said, if you can talk about the road to recovery from strokes.
Yeah, so let me, I want to make a point that I may have missed earlier. In 2020, Annette, we actually have seen, so a study that was published in May showed us that patients who are seeking care for stroke actually waited longer this year to access care than they did in any year prior. So if we look at, remember I said, time is brain is the term that you'll hear, but stroke is a time sensitive disease. So the evidence has already shown us that people are waiting to get to care. And I think that, a lot of that is because of the convoluted messaging around COVID-19. So I just wanted to address that because if there's anything else that you leave today's call with, I think it's that time sensitivity piece, right? It's like your house being on fire. You don't wait to call, when you see the flames going, you call immediately. And I think that's really what the message that I want to share. In terms of, and remind me the caller's name, Annette.
Dr. Joyce Graham.
Dr. Graham. So, and I wish one of my neurologist buddies were on the call, but I know enough to be dangerous. So I'm gonna give you what I know, and then feel free, Doc, to follow up with me, and we can have more elaborate conversation. And I can certainly get the team involved. But first and foremost, understand that the road to recovery, it is a journey. Of all individuals that I know, one person that actually was a part of our research, the earlier research in 2015, 2016 or so, she actually suffered a stroke on last year, and she's still in rehab in 2020. And so she goes to her therapy sessions on a regular basis. And for that reason, I say it is a journey back to recovery. I'm gonna go back to Elder's comment about really the lifestyle changes. The lifestyle changes are critically important so that we are not promoting, um, uh, uh, further exacerbation on our systems, that we're eating right, that we are in an attempt to do what we can in terms of activity and daily living activities. Um, I would also say that spiritual component of it is also, to my earlier point, really critical because it is that piece that keeps us grounded as we go along the journey. There's also another gentleman that I know that after suffering his stroke, he has been in rehabilitation for over a year now. He was on a walker at one point, and now He is walking without the walker, although, of course, he's walking a bit slower than what he was before. So it's that progress. Along the journey, I think that you're going to have to embrace. And part of that is marrying it with the other aspects, that I talked about in terms of the management of the stress level, to Elder's point, the food, intake, getting away from the processed foods, and then also that spiritual piece that kind of, like I said, is that glue that keeps it all together. So I would say that, embrace the journey, because everybody's journey is a bit different. But what I do know beyond a shadow of a doubt is that you have to stick to it. You have to, so that consistency is important, meaning making certain that you are staying in the rehabilitative modules, and that you're doing those on schedule, so on and so forth, because the body is relearning how to respond to your request from the brain. So the brain's saying walk, you want to walk, but the body's not doing it, and so it's literally retraining of the brain and the senses that occur. So again, it's that journey, and although sometimes it may seem like baby steps, just understand that people do get through that process, and they do see better outcomes. And so I definitely stay in prayer. But being in rehab and doing what you're doing is exactly what you need to be doing. Staying focused on that, staying focused in a positive space, net forward, all good stuff, moving forward. And then those lifestyle changes that I talked about will certainly get you to the outcome that you're looking for.
Beautiful, beautiful. So to summarize what you said, I hear trust the process. Trust the process.
Because it and I hate to be redundant, but it is so important to stress that it is a process, and that it just is. And so I think oftentimes we want to see the quick results, but the reality of it is that we are retraining the brain to do what it needs to do, because the brain has had this exacerbating experience. And so it will be a process, and so we have to embrace that, and that's just the reality of it.
Yeah, definitely, definitely. As humans, we want things when we want them, and waiting is not our forte, if you will. So yeah, thank you for that. Hopefully that helped you, Dr. Graham. Jerome Jackson, I think I called your name, but thank you for watching. Deatrice says, Annette, I am working on and listening, but we talked about my mom. She had a stroke also a few years ago. She is 95 and doing well. But we are watching her closely because she is stressed due to the fact that she can't get out of the house. That's another thing. And go to church due to COVID. That's deep. That's deep. Shakita, I see you on. Hey, Jamone, thank you for watching. Arnett, Shaunalee is on. Dr. Graham says that was helpful. She said, thank you. But what do you say to that statement from Deatrice about her 95-year-old mom? Because you already started mentioning about, COVID, having the fear of going to the hospital because of it. But then when others are going through that process, everything is so different now. The 7-8 months that we've dealt with, nothing is the same. Everything is unconventional now. It's, we're in an unprecedented time. So what would you say to her mom or someone else that may be dealing with the process of overcoming the stroke?
Yeah, I'm gonna say this was connected to my heart, and that's that you know the church, mama, being apprehensive of not being in the sanctuary. I think a lot of us have the same apprehensions about just different, things. But the reality of it is that COVID is shifting us as a society, period, the end. What we will look like coming out of this is going to be very different. And the blessing of it is that we have an opportunity to be innovative in terms of the way we respond. and what do I mean by that is that I think that for many of us, we were so accustomed to, as was I, getting up on Sunday. I'm an early morning service woman, so I get up. I'm 7 o'clock service, the whole nine. And on some Sundays, shoot, I'd be at somebody else's 3 o'clock, and somebody else's 9 o'clock service, whatever, and I'd be riding all around Chicago just to get it in. But at the end of the day, COVID has now put us in a different situation, a different circumstance, and the way in which we have to respond is going to be different. It has to be innovative. And I say that we need to, and in the instance of mom, this 95, if that were my mom, I'd be creating that experience right there in her house, because guess what? When the spirit falls, he don't fall subject to just being in the sanctuary, and that thing can fall right in in the living room. And it's the type of service that we all been waiting for, called an encounter, okay, that we hadn't had in a while. So what I would do is rid some of that apprehension by recreating the environment that she's missing, that she's looking for. So if that means being in the house with her and putting it up on a screen or on your computer, so that she can engage, then we have to be innovative, right? So that we can meet her where she is, because her fear is real, but we can meet her where she is in terms of what's going on with the church now, because the church didn't go away because of COVID, right? So how can I now get mama to understand that, we are the church, the church is right here, and, we gonna have church the way we used to right here in this living room. How can I help her create that experience is the question that I would ask you. And if that were my mom, that would be the atmosphere that I would be creating for her on Sunday. And like I said, for any of us, that love, praise, and worship, by the time we get done doing that thing, she gonna forget all about the fact that she have to get in her car to get that experience. Hello. Okay. So that's what this is about. We have to be creative, we have to be innovative, and we have to meet people where they are, because her fear is real. And understanding her fear, her apprehensions, and helping her to understand the transitions that we're making, I think will aid in the situation. Did I lose you? Can you hear me?
Yes, I can hear you. Can you hear me?
I can hear you now. Yes.
Okay, good. Thank you for that. I was mentioning that I know with Deatrice, her and her family, they typically get together a lot of times, but because of COVID, because her mother's elderly, they have to be careful and, watch about, getting over there to her or whatever. But, kind of like you said, thinking of some other creative ways to kind of help her to deal with that she's, like you said, it's a reality. She misses her church. Yeah, especially if you got a good church too. Or like you said, you run around Chicago, all these different services. That's something you've been taken out of that element now. So now what do you do to try to meet that need that you have?
And put those safety precautions in place, because we're really modifying the way in which we do things. To your point about mother, because I understand the fact with her being, elderly and not wanting to expose her. My mother has a ITP, which is a rare immune deficiency disease, and so just a common cold can cause a bad outcome for her. And so I hear you, but what we've learned to do is we've learned to create a system that is a little bit more supportive of the circumstance. So we're masked up. We go visit her and my aunt. Everyone wears masks there in the house. The washing of the hands. So those same safety protocols. Put those things in place. You still want to decrease her exposure, so you don't want to have her exposed to a whole bunch of people. But the reality of it is, I think what I'm saying is that we can create something that fills that void and that sense and that need that she currently has, whether that's with one person in the room with her with a mask on, so on and so forth, or with five people. And you have to, take on the right judgment, for her, knowing her independent circumstance. But we have to think innovatively. And the point that I'm making is that it will not look the same coming out of this. Nothing will look the same, coming out of this.
Yeah.
So waiting for us to get back to where we were is not the position that we should be taking.
Mm-mm. Have to get adjusted to the new normal. Hey guys, if you're just not joining us for today, we are talking to Dr. Knitasha Washington, ATW Solutions, and she is a wonderful woman of God. I'm so glad I met her. We've been discussing about stroke awareness during COVID-19, and hopefully there has been something that has been shared with you on today, discussed with you on today that has helped you. I see my cousin jumped in here, Curtis E. from Crosley. Thank you for watching. I tagged you purposely because Dr. Washington, I think she kind of does similar to what you do, but she's, dealing with health systems, and I know you deal with the hospital administration and all of that. So there's some connection there, but I wanted you to hop in and kind of listen in. You may have to rewind to listen to the entire session. But again, stroke awareness during COVID-19, getting us up, to par on it, to understand what it is we're dealing with, those that look like us, the Latinos, and how this has affected us, is what she has been discussing with us on today. Greg Owens, I see you also. Thank you for watching. Pamela, Dr. Regina Brooks, Kenneth Smalley. Thank you guys for watching. Make sure, again, when you come in, go ahead and click that share button so that we will share this with everyone else as well. What I'm going to do right now is actually take a moment to listen, have everybody to listen to this spoken word. It was actually penned by Elder Kevin McGee. He supplies Mind, Body, and Soul weekly with a spoken word relative to the discussion for the day. And so he has one. Dr. McGee, if you recall, Elder McGee, I'm calling him a doctor. Woo, I gave you a promotion. Elder McGee has a show with Intellectual Radio every Saturday at 12 noon. And again, he is the one who, I think he made the first comment about him in 2004 having a stroke, or that they diagnosed him with one. So let's take a listen to this, and then we'll come right back before we end.
Stress and strain, lack of rest, on the go trying to be everything to everybody when they don't even think about you like that. Because if they did, then they would tell you to slow it down, chill, and take a time out for yourself. You see, it's okay to have a relationship with yourself because then you will learn to love yourself and value your health. When folks say, "Can you do this for me?" you need to say no. Tonight, I have a date with myself. Or when they say, "I need you to run me here or run me there," your response should be, "I'm sorry, but I have a previous commitment to myself." You see, my wellness means more to me than you, and so I have to love on me because if I don't, then I could very well stroke out. And I'm not trying to go out like that, so I'm in a long-term relationship with the person in my mirror, and I devote myself to them. Better living, better eating, better workout, better mindset, so I can become a better me. Stroke doesn't have my address, and it never will, because it doesn't fit in my equation or my relationship. Right now, it's all about me, and I want to live.
Wow, wow, wow. Thank you so much, Elder McGee. That was on point. What did you think about that spoken word?
Absolutely on point. Absolutely on point.
Yeah.
I think we get so caught up in whatever it is, whether it's work, what have you, that we often forget about self. And that's what I received so clear from that message, is that it is okay to place that mandate to take care of self, right? And to spend time with self. Um, and for each of us, that may look a little bit different, but the benefit of it, for all of us, is clearly, toward our good. And so I appreciate that. Very
Yeah.
grounding, very grounding.
All right. Well, thank you. Thank you for that input. Elder McGee, I don't know if you're still on or not, but we appreciate that. That was very on point. Those of you that are here on the watch party, I'm so sorry. Forgive me. Josh, Tracy, I do see you guys over here watching as well. There were other names over there, but I do appreciate each and every one of you for joining us on today. It is a little shortened version on today, but I have to make my guests want to come back again. I don't want to hog up their time if they can't give me the full 2 hours. And I want to say, oh, last time she said I could only do a certain amount of time. But I do thank you guys for coming. Let's see. Deatra says, Mama Joyce. Oh, okay. I think that when Deatrice was talking about her mom, Dr. Graham didn't. She said she didn't know that. So again, you never know what somebody else is dealing with until you start talking, whether it is your own family or yourself. Let's see. JR, I missed this comment. A lot of us are seeking God on our own for the first time. In the past, some of us used to rely on, we used to rely on pastors for that. Yes, you are talking some stuff. I don't know how I missed that comment, JR, but that's the truth. PK Kid. All right. Oh, guys, this has been great. Dr. Washington, I must have you back. And again, I do appreciate you for coming in today, for taking time out of your busy schedule to share with us on today. And I know that the things that you have shared has helped someone. So do you have any parting comments for us on today that you want to share before we end?
Well, the one thing is that I would love for all of your listeners to take the opportunity to go to either the ATW website, ATW Health Solutions website, or the 2 Series website to take the pledge. And the pledge is a call to action. It's basically a social pact. It's a social contract. And that contract basically says that you understand the signs and symptoms of stroke, and that you make a commitment to acting appropriately in the event that you suffer from those signs and symptoms, and or are in the presence of someone who suffers um, those signs and symptoms. And so taking the pledge and making that commitment can save a life. And I'll again, uh, one of the most this is the most impactful research that I have done in my career. And the reason is because the community has owned it, people have owned it, and lives have been changed. And so sometimes what is very simple is also very profound. It's very simple messaging, but it's messaging that oftentimes our community didn't hear, didn't understand, wasn't necessarily privy to, and therefore could not respond to. And so, what I'm asking is for you to seek out that understanding by going to 2 Series, which is the number 2, and then CEERIAS.com. Go to 2series.com and take the pledge. There's also a whole bunch of materials and things, resources out there, articles, etc., videos, and they're culturally sensitive. That's the other thing I'll say, is that I do this for my commitment to my people, my community, people that look like me, my aunts, my uncles, my mother, so forth. So what we try to do is do this in a way that's attractive to us, and that we can receive it in a way that we understand, and that we take in that context so that we move into action. So please go to 2series.com, take the pledge, follow our research, spread the message, and be healthy. So thank you, Annette. I appreciate you, and I promise to come back if you invite me again, girl.
Yes, yes, yes. Y'all heard her, right? Good. Yes, that was wonderful. Thank you. As you were talking, JR did put the link in the comment section. So thank you so much, JR. I appreciate that. So you guys make sure you click on that link. Like she said, go take the pledge, get all the research, all the information that you need, from this research that they have done. And again, we appreciate you for all that you have done and all you're doing. It is definitely needed, and somebody had to do it, and we thank God that you have taken this on, and you're doing this, Dr. Washington. So I bid you Godspeed, and I pray that God will continue to bless and enlarge your territory and everything that you go to say and do. I do thank you guys again for joining us on this afternoon, for watching, for listening. You can always go back and listen to the recorded session once we end. Again, the video portion will be uploaded to YouTube. The audio is there now, and you can take your time and listen, take down some notes, whatever you need to do to help assist you or your loved one. I'm not thinking about you, JR. We will talk about that later. He's making comments in the section. But JR, thank you again for the connection. I can't thank you enough. This has been very good and very informative. Hey, you guys, I'll be on tomorrow night with Apostle Dion Hunt, A&D Conversation, 6 p.m. Central Standard Time. We are kind of doing like a little series about voting. So we're going to come back talking to you tomorrow about the churches. Has your vote been hijacked? Okay, churches, have your vote been hijacked? Come and meet us on tomorrow night to see what we're talking about in that respect, 6 p.m. Central Standard Time. Then next week, I will be back actually with 2 shows on next week. So check out Get Caught in the Net, Mind, Body, and Soul. My promos will be going out. I have a show on Wednesday at 12 noon Central Standard Time. And then also on Friday, I'm going to feature some amazing women. Friday, actually, we're going to talk about mental health during COVID. All right. So that's going to be a special segment, 10 a.m. next Friday on October 23rd. But then, of course, on the 21st, we'll have our regular 12 p.m. session. And I'm going to talk with Dana Simone about this gratitude journal. So you guys go to my website, GetCaughtInANetRadio.com. And until next time, I want you guys to make sure that you get caught in a net. All right, guys, you know what I always tell you at the end of every broadcast, make sure you stay safe, wash your hands, wear your mask, and vote. Take care, guys. We will see you soon.